Hi, my name is Rhiannon and I'm one of the physiotherapists at Aneurin Bevan University Health Board. We've developed these videos to give you some tips and advice to help you through your pregnancy. This video has been developed to give you advice on postures, positions and exercises to do during your pregnancy to reduce the strain on your body as your pregnancy develops. As physiotherapists, we see many pregnant women at all stages of their pregnancy. We have found by giving you information on postures, positions and exercises early, it can help you manage some of those aches and pains before they become problematic. Everyone is different in pregnancy. You may find all of the information useful, or you may want to pick and choose what works best for you. Symptoms can also change as the pregnancy progresses, so what you may not have found helpful in the early stages may become helpful as the pregnancy develops. Keep these videos as a reference so you can refer back to them as and when you need. So let's talk about posture. Normally, you want to have a small inward curve at your neck and at your lower back and an outward curve in the middle. Your pelvis should sit level and your weight distributed evenly through your feet when standing. As your pregnancy progresses, you will probably see some changes in your posture. As your baby grows, this causes your centre of gravity to move forward. You may naturally compensate for this, causing changes to the curves of your spine and therefore your posture. This may put your joints under extra strain. Having a better understanding of your posture will reduce the likelihood of aches and pains developing through your pregnancy. When you're pregnant, you may often find it hard to maintain one position for long periods of time. Here are some ideas on how to make common positions more comfortable. You may want to pick and choose what works best for you. In standing, keep your hips, knees and feet in line. This helps to distribute your body weight evenly. Take your shoulders back. Try not to hunch over. This will allow your rib cage to expand and move naturally. Tuck your bottom under, reducing the curve in your lower spine. This may help to limit the strain on your joints. Some people find leaning against a wall between activities helps reduce the strain on your back. When you're sitting, try and sit symmetrically, supporting your back with a rolled up towel if required. If you have a desk job, make sure your chair and desk are at the correct height. You're looking for your knees, hips and elbows to be about 90 degrees. You may find you require something under your feet to help you maintain this position. Things you use frequently need to be close at hand to avoid overreaching. If you sit for long periods of time, have a go at our pelvic tilting exercise as shown later in the video to keep your lower back moving. Next up, a few tips on everyday tasks and the best way to do these. We'll start with standing up from a chair. You want to avoid letting your bump lead the way. As you're getting up from the chair, sit on the edge, bring your feet underneath you and lean forwards. As you go to stand up, push down through your heels and stand up. This allows your buttocks to work a little harder and help support your pelvis as you stand up. Going up and down stairs. Again, avoid letting your bump lead the way and avoid pulling yourself up on the banisters. Put your foot on the step and lean forward so your weight is over your foot. Again, push down through your heels and lift your other foot up. As your pregnancy progresses, you may find that you have to go up the steps one at a time. Getting in and out of bed. Turn onto your side, keeping your legs together, drop them over the edge of the bed, and as your legs drop down, push down through your elbow or your hand to sit upright. Sleeping can be uncomfortable during pregnancy, but being on your side with a pillow for extra support between your knees and ankles or under your bump might be more comfortable. With lifting and carrying, try to limit carrying small children and heavy objects for too long, and only if really needed. Try to avoid favouring one side when carrying small children, shopping or your handbag. You may want to try and alternate the side in which you carry your child or handbag, and with your shopping, you may want to even out the weight between two larger bags or use a rucksack. In this next section, we'll be demonstrating some exercises that are important to do during your pregnancy. These include abdominal exercises and pelvic floor exercises. We're going to start with the abdominal exercises. This is sometimes referred to as abdominal bracing. These are important to do because as your baby grows, your abdominal muscles lengthen. As they lengthen, they become weaker and find it more difficult to support your back, pelvis and maintain good posture. To find the muscle, place your hands lightly underneath your bump on the lower part of your tummy. Breathe normally through your nose. As breathing out, gently pull your lower tummy away from your hands towards your spine and then relax as you breathe in. Imagine tucking your baby in towards your back as though you were giving it a gentle hug with your muscles. As this gets easier, you can start to keep the muscles pulled in as you continue to breathe in and out a couple of times. You want to be able to feel your tummy muscles move up and in, away from your hands. Aim to press to a maximum hold of 10 seconds and repeat up to 10 times as you're able to. It should feel as though your muscles are supporting your baby. You can also try this in all fours. When you're doing any lifting, pushing or pulling, it's important to do this exercise to help support your back and pelvis as much as possible. Pelvic floor exercises. The pelvic floor is the name of a group of muscles that sit at the base of your pelvis. The pelvic floor supports your bladder, bowels and womb, so it provides a vital role in maintaining your bladder and bowel control during pregnancy and in supporting your baby. Again, during pregnancy, these muscles lengthen and weaken. Therefore, it's important to regularly exercise these muscles to maintain and improve strength and function of your pelvic floor during your pregnancy and beyond. There is also evidence that strengthening these muscles during pregnancy helps to reduce the potential symptoms of bladder leakage after having your baby. If you experience any bothersome bladder or bowel symptoms during your pregnancy, still do your pelvic floor exercises and mention this to your midwife. So, how do we find and activate your pelvic floor muscles? As you can see, your pelvic floor spans from your coccyx bone at the back to your pubic bone at the front and sits between your two sitting bones. To contract the muscle, start as though you're trying to stop yourself from passing wind and then squeeze and lift up and forward as though you're trying to stop yourself from passing urine. You're aiming to try and hold for as long as you can. Aim for a maximum of 10 seconds. Release and relax for a few seconds and repeat as many times as you can, up to a maximum of 10 times. Aim to do this little and often throughout your day, ideally 3 times a day. Some people relate it to routine activities such as brushing teeth or making a drink. Some people find setting notifications on your phone helpful. There are also some apps available to help with this. Please see our useful links section on the website for this. If you're doing the exercises correctly, then no one should see that you're doing them. Be careful not to hold your breath, squeeze your buttocks, or squeeze your legs together. You may find that your abdominal muscles do work a little at the same time as your pelvic floor muscles. This is okay, however, make sure that you're able to breathe normally at the same time. You also want the muscle to react quickly. In order to improve this, practice squeezing quickly and strongly, then relaxing fully, repeating this up to 10 times. As you cough, sneeze or lift, try and do this exercise. This will help you prevent potential leakage of urine and support your pelvis. Next are a couple of exercises that you may find beneficial to do during your pregnancy. Pick and choose what you find helpful. You may find that this changes during the course of your pregnancy. Pelvic tilting. As you sat in the chair, let your pelvis tilt back, then tilt forward, growing taller. You shouldn't get any bending of your back whilst you're doing this, so all the movement should come from the pelvis. Next, I'm going to show you a couple of stretches for your back and pelvis. Take your time getting in and out of these positions. With all of these stretches, hold for as long as you feel comfortable or until any tightness subsides. All these exercises should never cause any pain. If they do, please stop. Lower back stretch. On all fours, place your hands in front of you. Keeping your hands in place, sit back towards your heels. You should feel a stretch along the small of your back. Go as far as is comfortable or until your tummy gets in the way. If you find that your tummy is getting in the way, you may need to move your knees further apart and let your tummy move between your thighs. Side stretch. Sitting with your feet touching the floor, place your hands behind your head. Bend over to one side and hold for a couple of seconds. Avoid twisting and then repeat this on the other side. You may want to try this one in standing. Hip flexor stretch. Place your knee on a chair, keep your other foot on the ground and hold on to something to support yourself. Push the front of your hip forward, gently squeezing your buttocks together at the same time and avoid any twisting. You should feel the stretch at the front of your hip and thigh. If you're experiencing any low back or pelvic pain that hasn't settled following the advice in this video, then please see our other video, Managing Your Symptoms of Pelvic Girdle Pain During Pregnancy. If you're an active person and regularly do exercise, there is no reason to not continue this during your pregnancy. For more information with regards to the level of exercise you should be doing, which exercises to avoid and when to stop doing exercise, then please see our link to the leaflet, Fit and Safe, Exercise in the Childbearing Year. This leaflet is supported by the Royal College of Obstetricians and Gynecologists. We hope that you found this video helpful. Thank you for watching.